MTP arthritis is arthritis of our big toe, or metatarsophalangeal joint. That's the joint where the metatarsal bone meets up with the phalanx. This is our big toe joint. When we're walking up and down stairs all day, climbing ladders, this is the joint that normally gets a lot of motion. As we get older, or maybe it's related to a trauma or our prior genetics, but people can develop arthritis of this joint that really limits them in terms of things that they want to do. Initial treatments for MTP arthritis are always focused on trying to get patients better without surgery. In many situations, we can place a little insert or orthotic into the shoe to stiffen up the shoe. We can try things like medicines that we take by mouth to cut down on the inflammation and the pain associated with arthritis. There are some situations where injections into the toe joint can decrease the inflammation and the pain, but at some point it may come to surgery for arthritis of this toe joint. Arthritis of the toe joint can be treated with surgery in a couple different ways. Sometimes we develop a big spur right on the top part of the toe joint. That spur is actually called hallux rigidus. And what happens is as we bend our toe down, a little nerve on the top part of the toe gets stretched, and so it hurts a lot. And then as the toe bends up, the toe actually bumps into that big bump. And so people find that the range of motion is most painful at what we call the extremes of motion, when it's all the way up or when it's all the way down. But that range of motion in the middle is okay. In those situations, a very simple outpatient procedure is called a CHEILECTOMY, where we come in and we just cut off that spur and close things back up. Patients walk out of the surgery center on their heel the same day, the stitches come out at 2 to 3 weeks, and there are no restrictions to activity after that. Patients can get back into running and doing anything that they want to do. There are situations where it's more than just the hallux rigidus, it's more than just that big bump. People actually develop arthritis of the entire joint. All the white stuff on the end of the chicken bone, that cartilage is all gone. What we do in that situation is called a fusion, where we come in, we take off the bone spur, we take off the rest of the cartilage, and we place a plate on top of the toe that actually makes what used to be 2 bones grow into 1 bone. After that sort of surgery, we're still able to put weight on our heel for a full 6 weeks right after the procedure, but then we can start getting back into our regular activities and regular shoes once we hit that kind of 6 to 8 week mark. No restrictions to activities after a fusion of that toe joint. People are still able to run, hike, be active. About the only thing you can't do after an MTP fusion is some forms of skiing, like telemark skiing, things that really involve a lot of motion of that toe joint. You can still wear a high heel up to 1 inch after that procedure, and it's very, very effective for pain at that big toe joint. To diagnose arthritis of the big toe joint, we're typically looking at x-rays. And what we see on x-rays is the narrowing of the joint space. The cartilage gets worn away and it makes the bones look closer together. We talk about raw bone rubbing on raw bone, and that really is what we see on the x-rays in this situation, is no space in that joint anymore, but just bone rubbing on bone. And that's very painful. Many symptoms that we see due to arthritis of the big toe joint are with our shoes. People will talk about when they're wearing shoes that sit right on top of the toe joint that maybe are a little bit tighter, it's very uncomfortable. Also activities that involve motion of that toe joint, things like kneeling, squatting, bending down, things that involve bending of that joint are very, very painful. Oftentimes, even just regular walking becomes painful when we have a lot of arthritis of that toe joint.